Hey CJ, wanna go to the gym?
No thanks, man.
It'll be short, like 30 minutes.
But my soap operas are gonna start soon.
You can watch soap opera later.
I've got a burger in the oven.
You can eat your burger later, it'll be short.
Alright, fine.
Gym.
Yo, Chris, my left arm feels kind of numb here.
What?
My left arm, I can't actually see you. My eyes are kind of going blurry here.
Right here.
Where are we going again?
The gym.
Gym?
Yeah.
Yo, Chris, my head kind of hurts a lot, and I feel a little dizzy and nauseous.
What's happening? Hey, wake up. 911.
CJ here has just had a stroke. Has this ever happened to you? Or a loved one? Post-stroke patients should participate in exercise training and rehabilitation. We offer this here at Douglas Stroke Survivor Exercise Clinic. Stroke, also known as a brain attack, occurs when there's a sudden blockage of blood to the brain. It shouldn't be confused with heart attacks, which is in the heart. Strokes are in the brain. It occurs when the artery is blocked or ruptured. Nerve cells in the brain don't get the nutrients and oxygen they need, so the stroke occurs. There are two types of strokes. The most common is
ischemic,
which occurs in the bloodstream in the brain when plaque buildup meets a blood clot moving through. The less common but just as serious
hemorrhagic,
occurs when there's an aneurysm in the brain, bloodstream, that breaks and blood gets into areas of the brain. Strokes have multiple effects on the patients. Nerve cell damage can result in changes in senses, behavior, language ability, memory, and thought processes. These will all be big changes in the stroke patient's daily life. It also depends on the part of the brain the stroke affected, as well as the severity of the stroke.
Hi CJ. Explain what happened when you suffered the stroke.
Well, the day I had the stroke, my friend came to my house and he asked me to go to the gym. I refused. It was during days of our lives and I didn't want to leave. And we were on our way to the gym. I started feeling a little weird and next thing I know, I'm in this hospital bed.
Explain how the stroke affected you physically.
Well, physically, I can't use my left arm anymore, and I feel like I don't have any strength. I can't walk anymore.
Explain how this experience affected you mentally.
Mentally, I had no idea that my life could get any more depressing than it already was. I don't know. It's just so painful to live with this.
What changes have you had to make in your life?
Well, I have constant supervision, and I had to clean up my house. You know, I can't have any beer cans lying on the ground or bags of chips on the ground because I might trip on them and fall and do more damage to myself. There's railings along my walls just to support myself, so keep myself up with my right hand as I walk. And there's caregivers coming in all the time to give me my medicine and watch over me. Sometimes even family. And I feel like I have no privacy.
Take us through the everyday life of a stroke patient.
Well, around 8 o'clock, the caregivers come to my house and wake me up, and they give me breakfast. They give me a sponge bath and take me out for a walk in my wheelchair. And after that, it's around noontime and they give me lunch, give me my meds, and they're out there. So between, let's say, around 1 and 3, I have privacy, and in that time I'm watching Oprah Winfrey. After that, I got family coming over to visit me. They may not want to, and to me it feels like they're obligated because of what happened to me, and I don't really like that. But they come for a few hours, and around 8, 9 o'clock I start getting ready for bed. Then 9:30, I'm out like a rock.
How would you like to join the Douglas Stroke Survivor Exercise Clinic to improve wellness, restore physical activity, and for overall rehabilitation?
I greatly appreciate that. That'd make a huge difference in my life, and I wouldn't know how to thank you.
It increases aerobic and sensory motor function. Aerobic training decreases cardiovascular risk factors. Individuals who are active have a lower chance of suffering a second stroke. Stroke survivors who train become just as healthy as age-matched people who have not suffered a stroke. Okay, CJ, today we're going to walk on a treadmill, okay? Okay? So you're going to go 1, 2, 3, up. Okay. Up. Up. Okay, we're just going to take it nice and slow, okay?
Okay, let's do this.
Good. How you feeling?
Okay, so far.
Good. Okay, we're going to work your upper arms today, okay?
Alright.
So now what we're going to do is let's run pull up, regular pull up.
No problem.
Good, good. Let's try your best. How high can you go? Tell me when it hurts. Good.
Right there.
Right
Stop.
there? Okay. We're going to work on that, okay? So you're going to go 1, and then bring it up as high as you can with your left, okay? And then you're going to go forward with your right, okay? Look to 10. Deal?
Alright, sounds good.
Ready? With your right. 1, 2, good.
So, CJ, after 12 months of intensive rehabilitation, how do you feel?
Chris, I feel phenomenal. I can go for walks. I picked up a dog just to make me go out and go for walks, make sure he's okay. Take him up whenever he has to go. It's good for me. It's a symbiotic relationship there. I've picked up a few books, dropped some of my soap operas, picked up House and Heroes, but it's been awesome.
Do you think your experience with the DSSRC has been a positive one?
No, most definitely. I feel like I'm not a liability to my family anymore. I can go out and actually do something with my life. I've gotten a job for Pete's sake. You guys have done such a great job with me. I can't thank you enough.